Right now, the Young Nurses Indaba trade union is calling for Eskom CEO Andre De Ruyter to be fired. The health union is accusing De Ruyter of gross incompetence which are costing lives. Power cuts have a dire impact on crucial equipment such as ventilators, and hospitals have been lobbying for exemptions from load shedding. Only 76 hospitals out of 213 in our country are currently exempted from the ongoing power cuts. Health Minister Dr. Joe Phaahla has confirmed that the department's budget to buy diesel is used up. For more on this, we're joined by the Young Nurses Indaba Trade Union's President, Rich Sicina. Thank you very much for your time, Rich, here on eNCA. Now, of course, I imagine that there are many hospitals that are suffering during these blackouts. Just give us a picture of how it looks on the ground.
Thank you, Masiko. Thank you to your team in studio there and the viewers of your show. You know what? Let me take everyone straight into the unit. I was in Pretoria to this other facility, Masiko, where I was representing members, nurses who are members of Young Nurses in the Trade Union, and others, they belong to other unions as well, but we ended up representing everyone. These nurses are thrown under the bus. These nurses are being blamed by the system. They are blamed by South African Nursing Council of gross negligence because there are two patients who actually died. How those two patients died? The electricity, there was load shedding. There was load shedding and generators didn't kick, Masiko. They didn't kick. Why they didn't kick? There's no money to buy diesel in that particular facility. And that situation in that particular facility is a reflection of what is happening in many facilities, but unfortunately no one is talking about that. So now, when this generator didn't kick in, ventilators failed. They failed. They didn't last even for more than 10 minutes. They felt, and resuscitations had to be taken. 4 patients had to be resuscitated at once. Unfortunately, because of gross shortage of staff again in our system, only 2 were able to be resuscitated, and resuscitations were successful. Others didn't make it. Obviously, healthcare workers, nurses and doctors in particular, found themselves in a precarious condition in between the hard place and the rock, where you have to choose which one to resuscitate, which one not to resuscitate. It's a dire situation because patients are, when these machines, ventilators in particular, when this on and off a situation because of load shedding, these machines eventually they die. They stop operating. The budgets, again, that facilities are being given. The budget cuts that were instituted by government, they are actually hitting a public healthcare system very hard because that easy. If there's no money, if Joe Phaahla, the minister, is confirming that there is no money to buy that diesel, what then do we do in our facilities when there's load shedding because generators are not going to keep? Are we not again being used by the system as accomplices of murder? That is why Young Nurses in the Trade Union again is calling for Andre De Ruyter must be shown the door and the body as well. This crisis must be classified as a crime against the state. People must be shown that door. They must suffer the consequences as well.
And I mean, Eskom is something that has been a problem for us for quite a number of years now. So I assume, you know, maybe this question is unfair for you, but how would you rate the current management at Eskom? Do you think they're the worst because of the number of days we've experienced with load shedding?
They are worse. They are completely worse, Marcelo. Yes, the issue of Eskom has been a progressive issue. It has been getting worse day by day, but it's completely worse now. It's either they come out and say we are failing, they must come out themselves and say we thought we will save this entity, but now we are failing completely. We are dismally failing, and they must actually come. They must come forward and tell us why are they failing. Is it maybe true that that dysfunctionality of Eskom is orchestrated to privatize Eskom? Can we say it's similar to what is happening in our public healthcare system? It should be rendered dysfunctional so that it can feed the private sector. Those in positions of authority, no, come on, they must be shown that door, because even a person who doesn't know anything about politics, who doesn't even know anything about the issues of Eskom and stuff like that, they actually can tell you now that those in positions of authority, the CEO of Eskom, they must just go. Finish.
And what happens if the, Andre De Ruyter and Mr. Oberholzer and the entire executive team at Eskom doesn't leave? What are you going to do about that? Because, as you said, nurses are being blamed for something they have no control over.
Masiko, we were actually talking about this to say the youth of South Africa, young nurses in the Privatization treatment is actually sending a strong message to the youth of South Africa. They must wake up. The youth of this country must actually wake up. We can adjust to this situation. I call it a frog and boiling water situation. At some point, the water is going to boil. And when we try to jump off this water, we'll go straight into the fire. So the youth must just wake up. Young nurses must wake up. All healthcare professionals must wake up. We must actually stand up and save the country. We must actually stand up and, if needs be, because that's the only language they understand. We couldn't shut down the system for 3% salary increases. Maybe now they will listen to us if we actually can organize each other. We are trying to do that, to say, let's organize each other, let's be intentional about this, and actually push those in positions of authority. Let's hold them accountable. Let's actually shut down the system and say we are tired of this. We are tired. You wake up every day. You want to go out there in your healthcare facility to excel and produce quality, bring hope where there's hopelessness. But you are going there to be an accomplice of murder. You are just going there to watch over a person dying because there's load shedding. No, it's if they are not being fired, if they are not resigning, we must do something as young people, in particular in South Africa. We can't tolerate this and just we are okay with that. Someone will stand in front of us on our TV screens and apologize and promise us heaven on earth that Eskom is going to be, all this crisis is going to be fixed tomorrow. Or something that we know it's not going to happen.
Now, tell me something. The health minister did say that he tried to speak to the Eskom executive so that he could ask them, for instance, to just try and exempt hospitals from load shedding. And they were explaining that it's quite difficult because hospitals are situated in communities. So if that community is load shed, it's very difficult not to load shed that particular hospital or clinic as well. Have you been speaking at all with the health department, for instance, or anyone, within government to try and see what they're trying to do to have a way forward, a positive way forward?
Actually, Masiko, we've been calling for this exemption. We've been calling for all healthcare facilities, not only above 70 facilities out of 210, out of more than 200 facilities in our system. We were actually calling for all the exemption of all healthcare facilities, clinics, your hospitals. All healthcare facilities must be exempted from load shedding. But again, these healthcare facilities are not shared by default, because when we are talking about Prince Msheni, in particular, Emlazi, when you are talking about Baragwanath, how do you exempt Baragwanath alone? Chris Fani Baragwanath alone, and say, I'm not going to, load shedding is going to happen around Soweto, load shedding is going to happen in Katlehong, for example, or in Vosloorus, but tell them Mokgwenyane Regional Hospital is going to be exempted. How is that the technicality of it? How is it going to happen? That is why then it's true. When we were trying to inquire to say, how is it going to happen? Why did you choose these few facilities? Why not all of them? Why not exempt all of them? The biggest question was to say the technicality, the how part of exempting this healthcare facility, because if you exempt Prince Msheni, you exempt Umlazi.
Yeah, and also, Rich, in terms of the fact that you're saying, for instance, in this particular hospital, and I'm assuming you said particular hospital in Tshwane because you don't want to say exactly which hospital it is in Pretoria. You said that they ran out of diesel and they ran out of money to actually procure the diesel. So are CEOs telling you about their frustrations in terms of budget that is now constrained because of the fact that they have to buy diesel and now they've run out of money? Because eventually, if budget is being used to buy diesel, eventually other things are going to start also suffering.
It's an issue myself of robbing Paul to pay Peter. It's a very dire situation. CEOs are hopeless. CEOs, they are absolutely hopeless. They don't know what to do. They are also controlled as well. I always say they exist. CEOs, managers, nursing service managers, clinical managers, those in positions of authority in our facilities, they just exist. They exist to maintain the status quo. But in as far as transforming the sector and the system, they are completely useless. That's hospital I'm talking about. I'm not going to just say that particular hospital in Pretoria, but it was a Jubilee hospital. It's not the issue of Jubilee hospital, the issue of not having a diesel. It's the issue of many hospitals that are actually saying, if then the budget, Masiho, the little budget they have, because they are actually diverting. We were actually saying this yesterday to say, okay, now it's a situation of saying you are actually asking questions to say, do you want to die full, like with food in your stomach, or you just want to survive so that you can go home and have food? Because now the money to buy bread, the money to buy food is being diverted. The money to make sure there's overtime to curb the gross shortage of staff is being diverted. The money to actually procure linen, to procure medication. People go to our clinics and the only thing they will get in our clinics is Panado. There's absolutely nothing in our shelves because the money is diverted to say, let's take this money that was supposed to buy food, to buy medication, to hire more nurses, to make overtime available. Let's take that money and divert it to buying diesel. What then are we? Yes, we are fixing this side, but we are destroying the other end.